Hi, I'm Dr. John Van Wagner. I wanted to talk to you today about spring allergies. Spring allergies are those nuisance symptoms that you get during the springtime, to include stuffy nose, runny nose, itchy nose, sneezing, itchy red, watery eyes. Those are some of the classic symptoms people may suffer during this time of the year. Typically, spring allergies begin about March 15th, middle of March, to sometimes April or May. And typically during this time of the season, it's the spring trees that are pollinating that people are allergic to that causes these symptoms. And so it can be a miserable time of the year for a lot of people that suffer from spring allergies. What can you do to help yourself? Well, sometimes it's beneficial to see an allergist who may be able to do some testing to determine whether you have, in fact, sensitivity or allergy to spring trees or spring or summer grasses. And so the testing can be done either with a skin test or a blood test. So knowledge gives us power, and I can tell patients based on a skin test what it is that you're really allergic to. And then with that knowledge, we can go into the season understanding that you in fact may need to be on some medicines to help you with some of these symptoms that you may suffer from. Now, a blood test can also be done to evaluate what you're allergic to, and it's equally as effective in helping me diagnose whether you're sensitive to the spring trees or spring or summer grasses. What can we do if you in fact have symptoms of spring allergies? Well, it depends on what symptoms you're having, but the typical over-the-counter medicines that are available for your use would be antihistamines like Zyrtec, Allegra, Claritin. I try to stay away from the sedating antihistamines like Benadryl or chlortramaton. Those are somewhat sedative, and they have some side effects that are undesirable. There's decongestants that you can find behind the counter, like Sudafed, that you sometimes can get, and that can help you with stuffy head and stuffy nose symptomatology. Afrin is another decongestant that's available over the counter that can help you with sinus pressure and stuffy nose. Now, there are also some other over-the-counter medicines that are newly available to the general public that you do not need a prescription for, and these would include the nasal steroid sprays like Flonase, Nasocort's over the counter, and also Rhinocort. Those are typical steroid nasal preparations that are non-addictive that used to be by prescription, but now they're available to the general public to be used. What I have found that is, if you will start those medicines, either the oral antihistamine or the nasal steroid spray, early on in the season, even before you start having symptoms, you may be able to cut down or eliminate or reduce the severity of your allergy symptoms during the spring. Now, for some people, even pre-treatment of these medicines before the season hits doesn't provide the relief that you need. In those situations, definitely I would suggest seeing an allergist, at which time, an allergist would be able to talk to you maybe about doing allergy shots, which is a more definitive way to treat your allergies by giving you vaccinations against what you're allergic to. It's much more effective than the medications, and they in fact are not a band-aid or mask the symptoms. They in fact get to the root of the problem at the immunological level and help reduce your sensitivities to the things that right now that bother you. If medicines are not working for you, or you're suffering complications from the medicines, or you're getting recurrently other types of complications like sinusitis or some eczema issues or concomitant asthma as a result of your spring allergies, I would definitely encourage you to see an allergist. We'd love to take care of you, love to sit down and talk to you about your problems and come up with a treatment plan that can get you to better health. We look forward to talking to you.